According to a report released by the Australia Institute, an independent public policy think tank based in Canberra, the COVID-19 pandemic has been paralleled by a wave of mis- and disinformation and conspiracy theories. How credible are these findings, and why are there so many conspiracy theories about COVID-19? What does this say about our world, and how worried should we be? To discuss these issues, I'm pleased to be joined by Chen Hong, professor from East China Normal University, and Rod Campbell, research director at the Australia Institute, and later we'll be joined by Dr. Kate Tulenko, CEO of Corvus Health. That is our topic. This is Dialogue. I'm Zhou Yue. So let me start with you, Rod. You are the author of such a report, but what exactly prompted your research into coronavirus conspiracies?
So our research started more broadly in looking at disinformation on social media. So at the start of this year, Australia had unprecedented bushfires, forest fires. We'd never seen forest fires like this. And scientists and firefighters, experts were all unambiguous that these forest fires were made worse by climate change. And yet, in the middle of this climate change-related emergency, on social media, we started to see the emergence of a coordinated campaign to blame other things, mainly to blame criminals for deliberately lighting these bushfires. So instead of a climate change emergency that might have pushed for more climate change action in Australia, we started to see messages trying to blame the emergency on other things like criminals. And so we started to look at where this kind of disinformation comes from. And after our terrible bushfires, the next big emergency has been coronavirus. And so looking at the way social media is handling disinformation around coronavirus seemed the logical next research step.
And what have you found about those conspiracy and the makers of those theories?
Yeah, so our analysis, we're able to get data from Twitter and analyse around 26 million tweets using supercomputers and mainly by our colleagues at the Queensland University of Technology. And what we found were, again, coordinated campaigns to spread disinformation around coronavirus. And the most common conspiracy theory, the most widely spread in a coordinated way, is this theory that China invented the coronavirus as some kind of bioweapon. And by using these kinds of coordinated tactics, basically a couple of thousand accounts are able to be seen and push this kind of disinformation into mainstream debate and mainstream discussion, and as we've seen, all the way to the White House.
Why do you say they are coordinated? How can you prove this is a coordinated effort?
Yeah, so our analysis was looking for accounts that retweet each other or work together within very small periods of time. So when we see accounts that regularly retweet each other on particular topics within 1 second of each other, you can be almost certain that those accounts are not genuine people just sitting at home, sitting on their computer, interested in what each other are doing. These are automated accounts. They're run by robots. We often call them bot accounts. So by looking at the way these accounts interact with each other over very short periods of time, either 1 second or within 1 minute, we can be pretty certain that they're not authentic human behaviour. They're a coordinated effort to promote a particular view, or in this case, a particular piece of disinformation.
So you are judging it as coordinated because the performance of the tweeters, not the identities of them. Do you know who are they and why did they do that?
So we don't know exactly who controls or sets up these accounts, but we've certainly gone to the account page And all of these accounts, almost all of these accounts, self-identify as being supporters of Donald Trump, supporters of the US Republican Party, or involved or keen on the right-wing conspiracy theory QAnon. So while we don't know exactly the names of who sets up these accounts, or the real names, we don't know who or if anyone is paying for them, but we certainly can look at what they say about themselves, and they say that they're largely supporters of Donald Trump.
So those theories you think are helping Donald Trump politically, and that's why this is coordinated disinformation, as you believe?
Well, I'm personally not sure whether they're helping him politically or not. I guess we'll all find out in the upcoming election. But it certainly seems to be the intention of these accounts and the intention of this coordinated social media campaign to promote, or it's the intention of Trump-supporting accounts to promote this kind of conspiracy theory, this kind of disinformation. So I imagine they believe that it would help the political prospects of Donald Trump.
And your study focused on actually, as far as I understand, 882 tweets about bioweapon conspiracy theory, and they were retweeted 18,498 times and liked 31,783 times. And what is more is that that generated an estimated 5 million impressions on the internet. So why did it attract so many views and interest, so much interest? Why people can't see this as a conspiracy theory generated by robots?
Yeah, that's a good question. But this is the point of a coordinated campaign like this, is to turn a relatively small number of tweets, as you said, a couple of hundred, and by working together, these accounts work to promote it to eventually be seen 5 million times. That's the point of this kind of campaign, is to take something from the fringe, from the extremist fringe, and bring it into the mainstream. That's what this kind of coordinated campaign is hoping to achieve. Whether or not that makes people believe anything, I think there's a different question to be asked about. Is it a problem that people believe in conspiracy theories? I think people are always going to believe some pretty crazy stuff, but it's a problem when there's a coordinated campaign to push this kind of dangerous disinformation.
Yeah, Professor Chen, I want your take on this. Not necessarily all the people who read those tweets believe in the tweets, but what effect do you think it has on people's perception of the problem?
Yes, if we remember, actually, during the Second World War, the Nazi Germany's propagandists, actually, they say that a piece of lie, a piece of untruth, once it is repeated 100 times or 1,000 times, it ultimately, turns out to be accepted or received as a piece of truth. So there is a particular logic in it, because actually, once a piece of misinformation is being repeated at a very higher frequency, higher than usual, then the public, the people actually becomes susceptible to its influence and ultimately turn out to be accepting it as the truth. So I think actually, according to the modern theory of communication, such a kind of technique is quite powerful in manipulating the people's understanding of the world, about themselves even. So once actually some misinformation, in particular at the time of crisis like now, during the corona virus, this crisis, people are actually eager to get various kinds of information, and such conspiracy theories can definitely arouse their interest and ultimately influence their way of thinking about how the virus come about. And especially, of course, the mass media, the social media is increasingly powerful to affect people's thinking.
Rod, do you agree that the social media has the power to spread something exponentially, whether it's not true or it's true or not. Rod?
Yes. So I think the role that social media plays and this kind of coordinated campaign plays is taking things from social media, from the fairly obscure parts of social media, and then suddenly more mainstream media start to report on what they see happening on social media, perhaps starting with some fairly fringe media itself, but then often you'll find something will happen like a celebrity, a sports star, a pop star, somebody who has a couple of million followers will share something, and suddenly it becomes mainstream discourse. And from there, it's only a hop, skip and a jump to the mainstream media, to mainstream newspapers and TV shows, and suddenly we have a real information problem on our hands.
What do you say to those people, as you said, some celebrities or even social influencers say, why do you say it's conspiracy theory? I believe that.
So, I mean, I think obviously it's a real problem to want to control what people, whether they're a celebrity or you and me, or you probably are a celebrity, I'm not. It's a real problem to want to control or what they tweet. But I think social media companies could and are starting to do a bit better job in fact-checking what some of their biggest accounts are saying. And the best-known example there is Donald Trump. Twitter has started to fact-check Donald Trump. But we've also started to see search engines, Google and others start to, particularly in the time of coronavirus, start to make sure that their algorithms are promoting, their searches are promoting actual factual information and official sources. So there's certainly, it's certainly difficult, but it can be done to limit the influence of some of these big accounts, celebrities, sort of super spreaders of disinformation. It's difficult. We need to be careful of freedom of speech, but limiting that spread is possible, and companies and governments should be doing it.
Yeah, that's indeed probably the most important question. So, Professor Chen, nobody's doing fact-checking on the internet. Celebrities and even some politicians are not responsible in that regard. President Trump and Secretary of State Mike Pompeo have claimed in public that COVID-19 may have come from research lab in Wuhan. Neither provided evidence to support the allegations. They're doing exactly the same thing as those conspiracy theories that Rod found generated by robots.
Yes, exactly as I have been discussing, by repeating a piece of misinformation, by this deliberate attempts of disinformation. Somebody, especially when this misinformation is being repeated or being resonated at a high up person, such as President Donald Trump or Secretary of State Mike Pompeo, the purpose for them is not to disseminate the fact, but simply to create this kind of impression. Even when this piece of information is definitely wrong, even when this impression is definitely wrong, but actually for them, as long as that kind of impression can be impinged upon the public, the people, to create this impression that China is actually the miscreants that actually is fully responsible for the spread of the pandemic, that will actually be reaching their effects. So in other words, the purpose for them is not about the facts, but it's really about this creating this kind of impression so that actually they can shirk their responsibility of mishandling the pandemic in their own country. That's of course America.
And can we say that some of them are choosing conspiracy theories selectively? Because obviously, Trump believed in the conspiracy theory that the virus was cooked in a lab in Wuhan. But when somebody pointed out that there is also something wrong with the lab in the U.S., he seems to hear nothing.
Yes, for example, the lab at rhetoric, that's a military base, So in fact, as the United States, in the U.S., in America, and also all over the world, has a number of biochemical and biological labs. For example, in Central Asia and also in Northeast Asia, in Korea, to be exact. Indeed, people are actually raising questions about the nature about those labs. I think actually President Trump and also his administration, high-up officials have been deliberately evading, to answer, those questions. There are a lot of question marks concerning those labs. What are they for? What are they developing? Why are they why are there so many of them, located in, foreign soil? But actually, of course, the Trump administration has been deliberately trying to hide, the true intention of that. I think actually lately, just the other day, Mike Pompeo actually blankly rejected, that the possibility, the prospects that any international independent inquiry is going to be carried out on U.S. soil. So definitely, this is a very rush, decision to be made. That's actually to block out any, outside inquiry or investigation on U.S. soil.
So what actually
why
differentiates
they,
conspiracy theories with factual statements or scientific discovery? Because all those theories, like the lab in Wuhan cooked the virus, or the Americans spread the virus in Wuhan, those theories are not fact-based. They are not proved by scientific evidence. In general, what is the criteria of deciding what is a conspiracy theory, what is scientific facts?
I think it is actually in human nature to be inquisitive, because we as human beings are inquisitive animals. So we're always actually trying to ask for the truth, trying to find out beyond actually what is being obvious. So there are people who are actually, interested in, for example, like UFO theories about alien invasion, about those X-Files stories, about the possibility of aliens among us. For all those, conspiracy theories, I think actually it is okay, because human beings are inquisitive. But for those people, for those anti-China smear campaign theorists who actually deliberately trying to link the Wuhan incidents with actually the virus itself, I think that this is actually definitely a kind of a deliberate attempt to smear China. I think actually even before the COVID-19 outbreak, internationally, there have been an upsurge of rumors about China, trying to attack China. So I think those people, they will not miss out a chance to attack China, to smear China.
And we have Kate Tulenko on the line. And Kate, can we blame COVID-19 for all those wild conspiracy theories, whether the origin or the therapeutic response or the effects on human beings? There are a lot of different theories going wild on the internet. Can we blame COVID-19 for the emergence of those?
Well, there have always been conspiracy theories, for hundreds of years, been medical myths. So that's not new. What is new is there now exist social media platforms that allow misinformation to be presented as reputable information. And these platforms reach tens of millions, if not hundreds of millions of people, and unfortunately get them to do things like not wear masks.
But why can't people make their sound judgment based on reasoning, fact-checking, scientific theories? Why can't people tell truth from the wrong theories?
I think part of it is that a lot of these social media sites become echo chambers, and people see that their relatives, their friends, people they respect or tweeting or liking these stories, and they're not doing the work of fact-checking. People do need to go to sites such as the World Health Organization's Mythbuster site, or their sites such as Snopes or PolitiFact that do nonpartisan investigations into these stories. So people need to do that work, and also
not a lot of people do that, don't they?
I mean, that's the challenge, and I think the real message to your listeners is make sure that you get your information and your medical information from reputable sources, and to stay off social media.
So, Professor Chen, whose responsibility is it for fact-checking? Is it the social media platforms? Is it the government? Is it the scientists and medical professionals and the institutions? Who has the responsibility to do that?
I think everyone has got a share to make sound judgments. The platform themselves, must have this sense of accountability to ensure, the accuracy of the information actually they're supposed to be providing to the public. While on the other hand, obviously, the government needs to have, institutionalized a system in which actually that will be actually able to discern, misinformation from the truth, so that actually definitely, sometimes definitely, infodemic, as we often call it, can be more dangerous than epidemic itself. It can really spread, in a viral way, very powerful, influential viral way. And on the other hand, of course, people themselves need to also to educate themselves. There are always,
but people don't.
Stories
they believe
about people,
what they believe.
Getting, cheated. I know, yeah, but of course, always we hear news about people, get cheated by, crooks, about fraudsters, in China and also overseas. But definitely, I think, in other words, the media and also, definitely whether it's traditional media or social media need to, have this kind of educational campaign to let people know that there are, misinformation lurking around trying to mislead us. So that actually, so it's, in other words, a concerted effort, coordinated efforts from the government, from the content providers, and also from the general public themselves.
All right, about the effects of those infodemics on the world and the people living in the world, we have gathered some opinions on the internet, what they have been saying about misinformation and disinformation in the time of COVID-19. John Laidlaw said, "This is not a surprise. Most sensible people know that the internet is a quadrum of misinformation, lies, and superstition." I'm not sure about that. Some of them are. I had one Trump supporter tell me that they read, but only conservative sites on the internet. They can never come up with factual proof or unaffiliated, neutral sites that verify any truth to the conspiracy theory. Well, Kate, do we still have neutral sites now, or people just stay in the silos and believe what they believe?
Well, I think there are still neutral sites out there. There's certainly peer-reviewed journal articles. There's a lot of media which has the purposeful intent to be neutral. And I think it's important that people, we read a wide variety of information and that they educate themselves. That's one of the most important things. And ask their physicians, their nurses for advice and to get that expert medical advice.
And earlier, Professor Chen mentioned that there are harms if those misinformation spread around. What are the harms if people tend to believe them and actually act on those information?
So we are seeing some of those harms. People who are refusing to wear masks, indoors in crowded situations. People who are declining to do social distancing. So that certainly will extend out the COVID outbreaks. And I think that, as far as the vaccine, we probably need to distinguish between anti-vaxxers and people with vaccine hesitancy. Anti-vaxxers are people who tend to use misinformation about vaccines to argue against them, whereas people with vaccine hesitancy are people who usually want to have a little more data or have their questions answered about vaccines. And I think that those are the people that we can reach and ensure that they do get the vaccine when it becomes available.
So you're saying the anti-vaxxers are acting on their belief, not on scientific facts. That's why it might be harmful for them and also people around them.
And actively spreading misinformation. I don't think I've ever seen an anti-vaxxer who was arguing on the true data. The anti-vaxxers tend to spread misinformation.
What about their argument that I have the freedom to choose my way of life and how I deal with my health issues?
Well, the problem is they're not following the law. And the law is saying that to protect people in a society, to protect the people who can't be vaccinated or infants who are too young to be vaccinated, we all need to get vaccines. And a lot of the anti-vaxxers are actually violating the law, and I think that's where the problem begins.
And Professor Chen, in China, do you think we have similar concerns about what people believe and what are the truth criteria for people to decide what should be the real information? What are those misinformation?
Yes. Yes, I think as the proverb goes, you cannot wake up someone who pretends to sleep. So definitely in China also there are people who deliberately will be misleading themselves into believing, some kind of obstinate, way, some kind of definitely, deliberately, almost sometimes, obvious, wrong ideas, wrong information. But for those people who do have a particular agenda, I think actually there are people who do have a particular agenda into, in a way that actually they mislead themselves and mislead others, in believing some kind of wrong information, like what we have been, witnessing in the West, people thinking that 5G can actually bring about the spread of virus. This is very obviously very wrong, but in fact actually there are still so many people who are believing in such misinformed ideas, so-called pseudoscience. So I think I should definitely say we need to alert not only ourselves but also the general public about the true harm of misinformation, and particular those deliberate disinformation attempts.
What about the political leaders' role in this? Because hearing things like chloroquine might kill the virus, or disinfectant injection into bodies. And do you think, Kate, that political leaders should be guarding their utterances, especially on issues that are related to public health?
Well, certainly we hope that any type of leader is following the advice of scientists and physicians. So yes, it is an issue. And regarding the economic shutdowns in U.S., we do need to keep in mind that is actually a decision that's made at the state and the local level. So even if we have people, the federal government, not going with shutdowns if cases spike, you take an example of a state like California, the 5th largest economy in the world, economy the size of France. That economy is completely controlled by the governor. And so if cases spike in California, he can put new measures on to prevent the spread. Or if the cases just spike in San Francisco, the mayor of San Francisco can put new measures to halt the spread of COVID in the city.
But isn't it the bigger problem that people tend to believe the information they've got are the true information that they should rely on for decision making, but sometimes they're not so well informed?
Yeah, that's where it's important that we all speak to our relatives and family members, that people check reputable sources. We do need to keep in mind that the economic impact, of this outbreak is really going to be a balance between the impact of the shutdowns. The U.S. lost 20 million jobs in the last 3 months versus the impact of illness and death. We know that in the U.S. as well as the rest of the world, bankruptcy and medical bills and illness are actually the largest cause of bankruptcy. So if we see increased spikes in COVID, we certainly will see a lot more economic hardship from that as well.
All right. Thank you very much, Kate, and thank you, Professor Chen, for your insights and analysis. And you've been watching Dialogue here on CGTN. I'm Joe in Beijing. Goodbye for now.